And if there's been a diagnosis of a fetal abnormality, it's sort of our job then to identify what that is, what it will mean for the pregnancy, what it will mean for their delivery, whether they can deliver locally or whether they would need to deliver in a tertiary centre where there's a little bit more in the way of support, and then also for them to get the opportunity to see the paediatricians and the geneticists and have some idea of what the future for the pregnancy and for this baby will be. And so prenatal screening tests might be tests, for example, where you know you have a family who have a high risk of a genetic condition, and they would like to know what their risk of that genetic condition is. Or it might be where everybody has a small risk of that condition, and I guess people most commonly think about Down syndrome when they think about that, and where we're able to do tests that pose no risk to the pregnancy, that is by doing something like a blood test on the mum or an ultrasound on the baby, we're a little bit better able to identify which pregnancies might be at highest risk. Now, diagnostic testing is where we don't just say to people, oh, this is your level of risk, but we actually find out whether the baby's got that condition or not. And not always, but often that involves an ultrasound guided procedure, for example, something like an amniocentesis or a chorionic villus sampling, where we take a tiny sample of placental tissue, and it gives us the opportunity at the genetics laboratory then to look at, for example, the chromosome count of the baby, or, as I say, if the family's got a high risk of a genetic condition, we're able to determine whether the baby's inherited that from the parents or whether the baby's free of that particular disease. So although we often think about the time of delivery and post-delivery, there are many steps along the road to hold the candle in the dark for those families from the time of that diagnosis. Very often families' expectations change during the course of the pregnancy, and it's important for us to be responsive to that. Sometimes people have had an expectation that they would prefer a caesarean section, that they want their baby born alive at all costs, that they wish to be monitored, for example, in labour, and that if there are signs of fetal distress, they would like a caesarean section done in the fetal interest. But sometimes as the pregnancy rolls out, it becomes clearer to them that it's perhaps more important for their reproductive future, for their health afterwards, or for their family when they go home, that they are assisted to deliver naturally. And these are difficult things for families to get their heads around during the pregnancy, anticipating the unknown to some degree, and it's our job to walk them through that. So the antenatal period is very important in planning the time that that baby has and what are the goals and objectives that that family would most like. We are mindful that the family have to tell us what's the most important things for them to achieve during the pregnancy and during the birth and during the postnatal period.
But they are after as well a little bit of that companionship, as Sue so beautifully described, holding the candle in the dark, and a little bit of the feeling of, although every baby's different and even with a similar diagnosis, the story may roll out differently, there's still that feeling of not wanting to be alone and wanting to have known that other people have done something similar and gone down, say, the palliative care pathway. So concerning diagnostic accuracy and concerning prognosis, we try to give patients as much information as we know within the limits of current knowledge, and as much as they want to know. We do face, however, despite the advances in medical knowledge, that we are left with uncertainty in some cases, and to sit with the families and try to be with them through that uncertainty and wait for time to help us all work out what's happening is an important job.
And if you need to get a second opinion to be sure, it's your family and it's your experience, and it's far more important that you satisfy every question that you've got rather than feel like you have to stay with the one person who's seen you initially. Sometimes it's quite helpful to see somebody different and get a different perspective. And for our team, we're always delighted when people come in with a notebook and they come in with somebody else, because we know when you get in front of a doctor or a counsellor or someone, you just forget exactly what you were going to ask beforehand. So write down your questions questions, bring them back to us, ask them again. Be sure this is an important time that we cover things thoroughly and carefully, and it doesn't matter how many times we have to go over it. The important thing is that you feel as informed as you can about what the immediate future is and what the long term might be, and these things will change as the pregnancy unfolds. Our expectations and the patient's expectations change. It is a remarkable privilege to work with families in these situations, and in situations that people might look on the outside and say, these are without hope and these are without future and this is so bleak. When it goes well, that child and the important role that child plays in the family, it's our job to make sure that that child and that family get the best experience that they can out of it. And you know, very often we're not dealing in a palliative care situation, so we have lots of optimism in the work that we do as well. But these families and their courage, they're a remarkable group of people to work with.
We do have the privilege of seeing ordinary people face extraordinary circumstances with extraordinary courage, and I learn from my patients.